Title: Natural Ways to Manage Diabetes, What Science, Ayurveda and Unani Reveal. Welcome to Herbs and Hymns, where we explore healing through nature, tradition and evidence. Today, we journey into one of the most prevalent conditions of our time, diabetes mellitus. It affects over 537 million people worldwide, and the most concerning part, it's not slowing down. Modern medicine, through drugs like metformin, insulin, sulfonylureas, and SGLT2 inhibitors, has helped regulate blood sugar. But these are often lifelong prescriptions. Many come with side effects, gastrointestinal issues, hypoglycemia, and long-term metabolic dependency. We are not here to reject modern medicine, but to introduce you to alternatives and complements. Systems like Ayurveda, Unani, diet therapy, movement science, and mind-body practices, all offering tools that may support, stabilize, and in some cases, significantly reduce dependency on medicines. There are two primary types: type 1 diabetes, juvenile, which is an autoimmune disorder where the body attacks its own insulin-producing cells; type 2 diabetes, where insulin is produced but the cells no longer respond well to it; and pregnancy-induced or gestational diabetes, another temporary form, though it has long-term risks for both mother and baby. The root problem in all types is a mismatch between metabolism and modern lifestyle. From ancient scripts to clinical trials, certain herbs have consistently shown benefit. Neem, or Azadirachta indica, has bitter leaves that reduce blood glucose naturally. Jamun, the Indian blackberry, has seeds rich in jambaline and ellagic acid, proven to regulate blood sugar. Karela, or bitter gourd, contains polypeptide P, often called plant insulin. Unani formulations, to be used with qualified practitioners, include Querce tabashir, Safufa zeabates, and Majuna de betel ward, all aimed at strengthening the liver and regulating sugar. Well-known Ayurvedic formulations include Nisha Amalaki, a mix of turmeric and amla; Datri Lao, an iron-rich blend with amla; Chandraprabhavati, widely used to improve glucose metabolism; and Madhumeha Rasayan, a rejuvenative tonic for diabetes care. These are not miracle cures, but many individuals under proper supervision have experienced improved glucose control when combined with diet and movement. Both Ayurveda and Unani emphasize digestive strength, or Agni. What to avoid includes refined sugar, white flour, processed snacks, cold foods, late-night eating, and emotional overeating. What to include are bitter, astringent, and pungent tastes, whole grains like millets, barley, and brown rice, spices such as fenugreek, cinnamon, and black pepper, and herbal teas like ginger cinnamon, amla tulsi, or fenugreek water. Modern research confirms that fiber-rich, low-glycemic diets improve insulin sensitivity and lower HbA1c. Mobility isn't optional, it's medicine. Studies show that walking 10 minutes after meals significantly reduces post-meal glucose spikes. Regular physical activity, even gentle practices like yoga, halts the progression of diabetes and protects against the decline in lifespan linked to the disease. Other lifestyle tips include eating early dinners, ideally before sunset, practicing a 12-hour overnight fast, engaging in deep breathing techniques like Anulom Vilom, mindful prayer or jika, and getting daily sunlight, especially morning rays. Regarding type 1 diabetes, also known as juvenile diabetes, though not reversible, some supportive therapies include ashwagandha for immune modulation, amla powder to enhance metabolism, beetroot juice for vascular support, and Safuf Mukawi Jigar as a liver and digestion booster. For gestational diabetes, supportive strategies include methi seed water soaked overnight, ginger cinnamon tea after meals, homemade millet rotis with ajwain, gentle walks post-meals, and stress reduction. Note: always consult your healthcare provider before taking herbs in pregnancy. What does modern science say about prevention? A 2021 study published in Diabetes Care found that intermittent fasting of 12 to 14 hours improved insulin resistance in pre-diabetics. A 2022 review noted that daily intake of bitter vegetables reduced type 2 diabetes risk by 35%. Natural fibers like psyllium husk, chia seeds, and amla lower glucose levels and improve gut health. Mind-body science shows that prayer, mindfulness, and time in nature reduce cortisol and inflammation. In short, prevention is not a one-time act, it is a lifestyle. There is no single cure for diabetes, but there are many pathways to manage and improve life with it. From bitter herbs to conscious eating, from movement to mindfulness, every step counts. At Herbs and Hymns, Our mission is to awaken awareness to time-tested solutions that exist beyond the pill. If you found value in this video, do like, share, and subscribe. Until next time, stay balanced, stay blessed. Before we end, here's a special takeaway, a curated list of classical Unani and Ayurvedic formulations that have stood the test of time in managing diabetes, especially type 2. From the Unani tradition, consult a qualified hakim for use. These include Coarse tabashir, which contains tabashir or bamboo silica, gulab, and ambar, used to reduce blood sugar and strengthen vital organs. Saphufaziabatis, a powder blend often containing gurmar, neem, and fenugreek, acting as a sugar-lowering agent and improving digestion and metabolism. Majun de betel ward, rich in herbs that detoxify the liver and stabilize sugar metabolism, often used in metabolic disorders with liver dysfunction. And Archimako plus Archibadian, herbal waters that improve liver function, digestion, and glucose processing, taken early morning on an empty stomach. From the Ayurvedic tradition, use under Ayurvedic physician guidance, Nisha Amalaki, a simple yet potent mix of turmeric and amla, enhancing insulin function and reducing inflammation. Datri Lao, amla with iron basma, supporting iron levels, rejuvenating the pancreas, and balancing pitta and kapha. Chandra Prabhavati, a classical polyherbal mineral formulation that balances metabolism, supports kidneys, and regulates blood sugar. Madhumeha Rasayan, a rasayana for long-term diabetic management, promoting vitality, reducing fatigue, and improving glucose uptake. And Vijisar, or Indian kino tree, traditionally used by soaking the wood in water overnight, with the morning decoction helping to reduce fasting sugar levels. These remedies do not replace medical advice, but can support your journey when chosen wisely and taken under expert supervision. Save this list and share it with someone you care about, because knowledge shared is health multiplied.